This presentation provides some fundamentals about running-related footwear. Questions and understanding about running-related footwear usually falls somewhere within this objective. Usually, I portion this at the end as it has clinical relevance, but not as much so as the other components that you see above. So it's helpful to start with looking at the anatomy of footwear. So you have three figures here. You have A, B, and C. The A figure shows the outer portion and the anatomy of the shoe, everything from the tongue to the throat to the eyelets, and so on. And so you'll hear some of these terminologies used by runners who are well informed about their running footwear. You'll also hear about this if you were to speak to an orthotist or someone who specifically prescribes running related footwear. And so I think it's helpful to have some context as to the nomenclature and the definitions of the anatomy of the shoe. In figure B, you see that the shoe can be broken up into an upper portion and a bottom portion. And once again, you'll see that the different portions of the shoe are outlined there. And then the C figure shows the kind of the inner portion of the shoe where you have the wedge, the outer sole, the midsole, the insole of the shoe, the sock lining, of course, and then the heel counter. And you can learn more about this by following the resource by Prado et al. In 2019. I'll include that within the references. All right, so the classification of shoes runs anywhere from a minimalist shoe all the way up to a motion control shoe. And then in the middle, you have stability and cushion or neutral based shoes. And you can see that this is on a spectrum of more support with the motion control to less support with the minimalist shoe. So the minimalist shoe has reduced mass and rear foot to 4-foot height differential. That's essentially the slope or how much plantar flexion the foot is in at rest within the shoe. The cushion and neutral shoe has the midsole, shock absorbing materials, and minimal supportive elements. Stability shoes are medial support, such as a dual density midsole. And then finally, your motion control shoe is has firmer density within the midsole, and then has thermoplastic reinforcement. Now, some of these shoes, irrespective of the amount of support, have become even more technology advanced, such as having carbon fiber plates put in that are energy returning and energy storing to help to improve running economy. There have been some shoe lines that have even been banned from competitive running as well. But it's helpful to know that the difference is when you hear a stability shoe versus a minimalist shoe and where it falls relative on the spectrum here, as well as some of the basic components that they entail. So just giving you some visuals here of the different types of shoes that were mentioned previously. So the neutral shoe, the stability shoe, the motion control shoe. And you can see some examples listed for each. So the neutral shoe is good for within normal limits, foot structure, pes cavus, hypomobile, mid and or forefoot, and a supinated foot. It's got more of a curved shape to it. The stability shoe, again, giving a little bit more cushion, good for mild pronation, hypermobility of the first ray, forefoot varus, slightly excessive rear foot eversion, and it's also got, as I mentioned in the previous slide, high density foam near the midfoot and less cushion than the neutral shoes. things, examples of the brands and the versions of these that are on the market include the Nike Pegasus, the Brooks Adrenaline GTS. Motion control shoes are good for excessive rear foot eversion, pes planus, hypermobility of the first ray and midfoot, and really it's, as the name entails, intended to support a more flaccid or mobile foot, if you will. High density foam near the midfoot, plastic aspects at the posterior lateral heel, and is the most cushioned throughout compared to the others. And then you have the A6 Gel, the A6 GT 100, and the Mizuno Wave. Again, you can see the reference there for further detail regarding the footwear. And then finally, you have the minimalist shoe, and this is has shown like when someone transitions to a minimalist shoe, what has shown is that they will be decreased stride length, increased cadence, decreased peak patellofemoral joint stresses by 12% in comparison to shod runners. There's a decreased ground reaction force, increased demand on the foot and ankle versus the knee, as someone usually will transition more to that forefoot or midfoot type striking. 10 of 19 minimal footwear runners exhibit bony edema in their feet consistent with stress injury. So this transition needs to be done slowly and deliberately, often phasing in and out of the minimalist shoe should a runner or patient or client that you work with want to make this transition from your more traditional shoe. There's also rapid alterations in running pattern places runner at risk for injury. Again, may reduce injury risk at the hip and knee, but increase injury at the metatarsals, the plantar fascia, and the Achilles. So really suggesting that this, depending on where the injury is in question, that a minimal shoe will distribute the stress differently along the limb. And again, the modifications of footwear, if going from or initially transitioning into a minimal shoe, needs to be done in a very progressive and strategic manner to prevent any overuse or excessive stress or physical stress to the tissues in question, particularly around the bones and those tissues around the foot and the ankle. So these next couple of slides just break down those categories that I showed you in the first slide, where you had your minimalist, you had your neutral, and then you had your stability shoe and your motion control shoe into further delineations or categories. So a lightly cushioned shoe is shown here. It's more appropriate for a supinated foot. Traditional cushioned shoe is more of has a more of a curved shape to it. Central or peripheral slip last construction to it. The midsole is made of the EVA and the PU, depending on the body weight, but usually lean to lightweight EVA. Slightly denser midsole and very flexible through the midfoot. And you can see the example of the Adidas shown there. So the straight last cushion shoe is more of a wider foot and fits usually more appropriate for a more rectangular foot. It's got more cushion than that of the lightly cushioned shoe that we just saw. It's more appropriate for a neutral to supinated foot, but that is more unstable or has more mobility to it. It's a newer transition shoe that bridges the gap between the cushion and the stability or the stability control or motion control shoe. And then it's again due to the geometry of the shoe, and that is that when it speaks to the straight last shoe, this is that wider shoe box that I alluded to. So the midsole made of the similar materials, but may have a lighter, more buildup on the outside, again to provide a little bit more support. Single density midsole. And then you also know there at the bottom that has a firmer heel counter. What that means is that where the if you look at the top portion of the heel, that it actually supports and or cradles the hind foot just a little bit more, kind of controlling that pronation. So the stability shoe is neutral or mild overpronating foot, is most indicated for. You have a semi-curved last, and so the last itself, it refers to the form on which the shoe is constructed. It's really the shape of the shoe that determines what type of last the shoe is. So the shoe last determine the toe shape and the heel height, as well as the curvature of the shoe. It also refers to the construction technique used on the shoe to attach the upper to the midsole. In the construction, shoes may be board lasted, slipped lasted, or combi lasted, or strobe lasted. And this simply refers again to kind of the symmetrical makeup of it during its construction. As far as its clinical relevance, really, for me, it comes down to comfort, and rather than like look. It's rare, if ever, have I recommended a particular last shoe for an individual. Usually, I'll go more based off the uh, broader categories of the stability shoe and so on. But it's important, once again, to actually have some context or some familiarity with the nomenclature here. So the stability shoe, as the name entails, is firmness, a medial midsole, or stabilization device, depending on the range of the stability shoe. Lower end stability shoes may not have a stabilization device built within. Some flexibility through the midfoot, but again, it has that firm heel counter, which is kind of the cradling around the Achilles or the back of the calcaneus, promoting or kind of protecting against any pronation, particularly upon heel strike. And the most supportive shoe is the motion control shoe that is for the moderate to severe overpronator. It has a straighter last to it, mid rather than the curvature that we've seen in the previous models. The midsole material is made of the same materials, the EVA and the PU, depending on the body weight of the individual. And then the firmer medial midsole or stabilization device is built within the shoe. We'll sometimes use higher medial sided versus lateral sided wedges for increased early motion control as the foot hits the ground and attenuates to the shock absorption. Okay, so what is the evidence of prescribing shoes based off foot type? I have been pretty convinced by large studies such as this one, even though it is a little dated at this time point. So they did a randomized control trial for over 7,000 military recruits. The experimental group were assigned to a neutral stability or motion control shoe based off their plantar shape, low, medium, or high foot. And so they used kind of a Likert scale, as you can see in the figure 3 off to the right. And what they found is that there's no significant difference in injury rates between the military recruits for those individuals where the shoe type was prescribed based upon their foot type, or if it was just randomly assigned to the control group. So the conclusion that they came up with was prescribing running shoes based on arch height has no influence on injury risk in military basic training. Often what I have clinically, my interpretation of this is that I usually tell patients that the most important thing or variables around shoes include the age of the shoe, the overall comfort of it. There's even some evidence to suggest that having a variation of different types of shoes that you run in provides further adaptability of the system and of the foot and the ankle, and force distributions upon runs. So that is another consideration rather than really being as prescriptive or as precise as getting into the different stratification technologies that otherwise exist. Of course, usually what I'll often do is take a multidisciplinary approach to this. So either directly referring them to an orthotist if I really think it's necessary. I'll certainly recommend over-the-counter orthotics as that has shown to be sufficiently beneficial for the vast majority of individuals based off the literature. I will also consistently have them go to either road runners or Fleet Feet to get an actual recommendation from the shoe salesman, both of which I found to have really good recommendations and have gotten positive feedback. So if you're interested in going down the technology route of understanding the shoe mechanics and the biomechanical effects there within, that's great. The research doesn't always support that. In fact, I think you're better off putting the person in front of the individual that may be best able to do so. And then again, it's somewhat of a dated article, but still a large pool number of of articles included here, as it is a systematic review, and no clinical trials that assess the effect of pronation control or elevated cushion heel designs with regard to injury rates, distance performance, OA risk, physical activity levels, or overall health and well-being. So the prescription of such shoes to distance runners is at least at this time point from the research that I've been able to identify is not necessarily evidence-based. No scientific evidence to support the differentiation of biomechanical differences between the stability and the motion control shoe. I have instances where changing shoes helps to assuage some of the load over an injured area? Yes, by all means. Was it because of the type of shoe that it was? Was it a placebo effect because they actually had a shoe that was comfortable, or that the other one had otherwise seen its better life and no longer was the foot and the ankle or the knee having to compensate for what was the deterioration in the stability or the integrity of the shoe. And at least it can be recommended that changing running shoes every 350 miles, as several studies have shown that new shoes lose half their cushion by 250 to 500 running miles, depending on the brand and the type of shoe. And to promote proper training to avoid injury risks is probably the most important. So I leave you with the diversification of footwear. I leave you with ensuring that it is consistently updated and getting new tires on the treads, if you will, in order to make sure that there's less compensation within the system or on the biological structures. And I will say that often 250 to 350 miles is not a great deal on a shoe. You'll often be surprised that the shoe it doesn't look worn at that time point usually. And so I think that's also a good educational opportunity for you as a therapist to educate the patient and have them at least potentially track their miles per week, multiply that by how many weeks or months they've had the shoe to get a gross estimate. So the more recent systematic reviews have been conducted by the Cochrane Review Library. So they have wonderful methods and have been quite exhaustive, searching over 12 different databases. You can see that the initial publication was the most recent two updates have been in 2019 and 2020. The original publication was early in the 2000s. And the most evidence demonstrates that there's no reduction in lower limb running related injuries in adults when comparing different types of running shoes. Overall, the category of the evidence determining whether different types of running shoes influences running related injury is very low to low. There is also no evidence that prescribing footwear based on foot type reduces running related lower limb injuries in adults. All three trials that were conducted when comparing the rates of injuries were performed actually within the military population, as previously demonstrated in that 2014 article. The definition of a running related injury should be better defined in coming studies in the research, and more research should be considering randomized controlled trial design to increase the evidence in this area. And then lastly, they also say that future work should look to explore the influence of different types of running shoes upon injury rates in specific subgroups. So all in all, take it for what it's worth. Is when you pool the data and you look at this, is that there no strong evidence currently exists, at least when you look at the broad spectrum of the literature to date. However, some recommendations can be made, is that it has to be comfortable for the individual. Don't run in aged shoes. It matters not as much per se as far as like the shoe type prescription based off someone's resting foot posture and arch height. All right, and running related footwear is an enormous topic in and of itself. We could spend an entire day just talking about it. For those who are interested, I also offered this resource in this monograph, running footwear, matching structure and function within the shared drive. So you have access to this PDF should you want to go further into understanding footwear, its mechanics, and its clinical application. I really do endorse this resource, and even though the majority of today's session has been focused on really just the bare bones fundamentals and orienting you to the anatomy of the shoe. Okay, so here's just an example of a table that's found within that monograph that I was just speaking to. And you can see in the first column, you have your type of shoe or the brand of shoe, and then you have the different lines or the models there, and then how each of them is classified between the cushion, the minimalist, the motion control, the stability, and the neutral, respectively. And this is helpful. So when a patient comes in and they're asking about, well, where does my shoe fall, or what shoe should I be looking for, or what have you, and they throw out different brands to you, you can actually have an idea as to where it falls on the spectrum that has been presented here. Again, the footwear is an enormous topic in some paradigms, particularly within looking at biomechanics, and the technology within these shoes are continuing to evolve. Should you want to dive into this resource, I think that it does give you some competency, some knowledge base, and maybe provide a launching pad for further learning in regards to running related footwear. Thanks for listening.